Whether you're enrolling in a Medicare Advantage plan for the first time, switching your current coverage, or renewing your current coverage, it's important to know what to review prior to choosing a plan. In this video, we're going to go over our Pre-Enrollment Medicare Advantage checklist so that you can feel more confident in your decision. Hi Medicare community, my name is Lindsay Engel. I'm the Medicare expert for Elite Insurance Partners and MedicareFAQ.com. Our Pre-Enrollment Medicare Advantage checklist will include checking which doctors are in your plan's network, the coverage area, cost sharing, the summary of benefits, and your drug formulary if the plan includes prescription drug coverage. The first item on our pre-enrollment checklist is doctor networks. Medicare Advantage plans are most often HMOs or PPOs with limited networks. It's important to check that all of your physicians are within the plan's network. If you're someone who has multiple doctors, it's important to check that each one does accept the plan you're choosing. Also, it's important to take into consideration that if you need to see a specialist, it will require a referral from your primary care physician. The next item on our checklist is coverage area. It's important to know that Medicare Advantage plans do not travel with you. Some plans even restrict you to the doctors within your county. Make sure to consider how often you travel. If you do travel a lot, then a Medicare Advantage plan may not be a good option for you. Now let's go over the next item on the checklist, which is cost sharing. Cost sharing varies from plan to plan. It's important to understand all the different forms of cost sharing your plan comes with. This includes deductibles, coinsurance, and copayments. You'll want to check how much your copay is to see your primary physician as well as a specialist. If you do see your primary physician a lot, having a small copay, whether it's $5 or $20, can quickly add up. You'll also want to check what your maximum out-of-pocket limit is. Each maximum out-of-pocket limit does also vary from plan to plan. Usually, the lower the monthly premium, the higher the out-of-pocket limit will be. Having a good understanding of all the different out-of-pocket costs your plan comes with will help you better prepare for your healthcare cost. Next on our pre-enrollment checklist is extra benefits. If you're looking for a plan that covers dental, vision, and hearing, it's important to check your benefits because not all will include all three. You can also ask your agent if there's a Part B reduction. A Part B reduction is when the plan reimburses you some or all of your Part B premium. This is not available in all areas. The final thing on our pre-enrollment Medicare Advantage checklist is to go over all the important documents. One of those documents is a summary of benefits. This is very similar to the outline of coverage, but the format is standardized across all plans. This makes it much easier to understand. The important things to check on your summary of benefits include the benefits, including exclusions, your deductible amounts, your coinsurance and copayment amounts, your out-of-pocket limit. It also should include direct links to your preferred provider directory and your drug formulary, and will also include any referral requirements. The next important document is your annual notice of change in evidence coverage. Now, this is what you'll receive if you're already currently enrolled in a Medicare Advantage plan. These are mailed to you each September before the annual enrollment period. These documents will inform you of any changes that will take effect to the plan in the following year. The last important document you'll want to review is your plan's drug formulary if it includes prescription drug coverage. The drug formulary, or drug list, will include all the medications your plan includes. You'll want to make sure that you check that each of your medications is listed on the formulary. You'll also want to make sure you check the deductible for prescription drugs. This can vary anywhere between $0 to $445. The formulary must include at least 2 drugs per category. It will also include both brand and generic name drugs. You'll want to make sure to review the step therapy criteria. The step therapy criteria will go over certain circumstances in which you may need to try a lower cost drug before they approve another one. Also check the prior authorization criteria. In this section, they'll go over which drugs need special approval. In the case your drug is not on the current formulary, you can always request a formulary exception. So that completes our pre-enrollment Medicare Advantage checklist. If you're wondering which enrollment periods you can make changes to your Medicare Advantage plan or enroll in one for the first time, this includes 3 separate ones. This includes your initial coverage election period, which comes around when you first age in at 65 or become eligible due to disability. The second one is the annual enrollment period, which comes around every fall between October 15th and December 7th. The third enrollment period is the Medicare Advantage open enrollment period. This comes around every year between January 1st and March 31st. For this enrollment period, you're only eligible if you are currently already enrolled in a Medicare Advantage plan. Thank you so much for watching. I hope you enjoyed this video and found it educational. If you have any more questions, feel free to leave a comment below. If you haven't already subscribed to our YouTube channel, make sure to do so. Always have notifications on so you're notified each time we upload a new video. We also have a fantastic Medicare community on Facebook. There'll be a link in the description below so you can join. Until next time, bye!